Good evening, my professional colleague. I will be presenting a seminar topic on the role of honey in wound management and infection control in medical surgical nursing. The role of honey in wound management and infection control in medical surgical nursing. The behavioral objective: to explore honey as therapeutic agent, to explain biochemical composition of honey, to identify the types of honey, of medicinal honey, demonstrate wound assessment skill, promote patient-centered behavior when using honey, to improve adherence and outcome in the use of honey. Introduction. Honey is a natural therapeutic substance. One good thing to know about honey is that honey is sweet, and honey is used in medicine historically. The reemergence in modern practice of honey. Honey reduces infection and promotes healing. Honey is very relevant because of the antimicrobial agent. It kills bacteria in circulation and on the surface of the wound. It also has pain relief agent, which improve adherence of patient during wound dressing. The composition of honey. Honey is composed of sugars. The sugars is made up of glucose and fructose. Honey has enzymes. The name of the enzyme is glucose oxidase. This glucose oxidase is used as antioxidant. Honey contains hydrogen peroxide, which is an agent that is used in killing bacteria and microorganisms. Honey has antioxidant and flavonoid in it. Honey has low pH, of which there are some microorganisms that will not survive. There are some microorganisms that will not survive at low pH. That's acidic condition. Some of these organisms are acidic. They are acid-loving organisms, while some are alkalinic-loving organisms. The one that acidic-loving organism will not survive in the presence of honey. It has multimodal antimicrobial action. The types of honey. We have honey all over the world. Some are found in Asia, some are found in Africa, some are found in Europe. The types include Manuka honey. Manuka honey is a potent antimicrobial agent. We have Tualan honey. Tualan honey is antioxidant rich. We have medical grade versus raw honey. This is common in Africa. We have honey that is standardized for clinical use, recommended in hospital, and the honey contains hydrogels for sustained release. The mechanism of action of honey. Honey have antibacterial agent which kill bacteria on the surface of the wound. Before ampiclox powder or antibacterial is applied on the surface of the wound, but research has been shown that ampiclox should not be applied directly on the surface, but the drug should be taken systemically to kill the bacteria in circulation, thereby freeing the bacteria on the surface of the wound. The question now is, what happened to the bacteria on the surface of the wound when the one in circulation are killed? Honey fit in this condition. When this honey is applied at the surface of the wound, it kills the bacteria and it improves wound healing. Honey has anti-inflammatory activity. Honey helps to immobilize bacteria on the surface that are on the surface, thereby killing them and reducing inflammation. It is the presence of bacteria that causes inflammation. When these bacteria are killed, inflammatory activity will reduce. It has osmotic property. This osmotic property helps in killing bacteria. It promotes granulation and epithelialization. It controls wound odor. It is a bacteria that causes odor that makes wound to be smelly. When honey kills this bacteria, the odor will be reduced. It reduces oxidative stress. The clinical use of honey. Honey is used in chronic wound and ulcer, pressure and diabetic foot, surgical wound and burn. Is used in infection control and in inflammation reduction. It improves patient comfort and adherence. Nursing theoretical framework. We have up to 3 theoretical frameworks that support the use of honey. But for want of time, we'll just pick 2. I'll just pick 2 and explain. The first one is Nightingale's environmental theory. This theory states that if the environment is conducive, healing of patient will improve. Patients are supposed to put in a conducive environment for healing to take place. Honey makes the environment, the wound, to be free of microorganisms, thereby enhancing wound healing. We have Orem self-care deficit theory. Patient self-care is improved when they are taught how to use this honey. Patients are taught how to apply the honey even at home, not necessarily in the hospital. The next one is nursing responsibility. When applying honey, assess wound type and the stage of wound, select appropriate honey dressing skills, apply honey using aseptic technique, monitor healing progress regularly, educate patients and caregivers, document all care accurately. The behavioral advantage: it reduces pain during dressing, enhances patient adherence, improves patient comfort, reduces anxiety and stress, empowers patient self-care behaviors, and promotes health-seeking behavior. The advantages and limitation of use of honey. Honey is a broad-spectrum antibiotics. It has broad antimicrobial activity. It promotes tissue regeneration, and it is cost-effective and safe. When you are comparing honey with most of the antibiotics, you would agree with me that honey is very cheap. Honey can be applied on a very big wound for more than a month. With less than 5,000 naira, you can use this honey on wound for a long time. The limitations of honey: there is risk of allergen since it is applied on the surface as a foreign agent. It is not used for deep cavity wound. More clinical trials are needed for the use of honey. Implication of the seminar: enhance patient care and outcome, support evidence-based nursing practice, encourages patient self-care behaviors. It guides hospital policy development, promote cost-effective wound management, and it is also very relevant, implicative for future research. And policy can be made for the use of honey because of its importance. In conclusion, honey is effective for wound healing because of the antimicrobial agent. It has pain relief agent which help to reduce inflammation and pain from wound. And this anti-inflammatory property of honey will make patients to have more adherence to treatment, and it improves their comfort. This use of honey integrates nursing theory and practice. It is complementary therapy in nursing. Thank you for listening.